Okay, Kilgore College, Oliver Tidwell, head to toe assessment. Here's my room scan. All of my equipment has been sanitized. I'm performing hand hygiene. Knock knock.
Yeah.
Hi, my name is Oliver Tidwell. I'm a Kilgore College nursing student. Can you confirm your name and your date of birth for me?
Yeah, Diego Flores, date of birth is September 1st, 2000.
Okay, do you have any type of allergies?
I do not.
Okay, so today we're going to be doing a head to toe assessment. I'm going to be looking, listening, and feeling for anything unexpected. You're positioned properly for this first portion of the assessment, so we can go ahead and begin. I just need to ask you a few questions first. Where are you at today?
I am in Kilgore College.
Okay, what day is it?
It's Wednesday.
And why are you here?
It's for a head to toe assessment.
Yep, okay. And can you talk to me about what you generally eat on a day-to-day basis?
For breakfast, I eat eggs with cheese and tortillas, and then I usually fast in the afternoon. And then for dinner, I have chicken, rice, and potatoes.
Okay, do you have running water at home?
It's cold, but it's running.
Shower every day?
I do.
Okay, that's good. And the client's pulse oximetry was 98% on room air. Can I ask you, can I see your wrist?
Yeah.
Do you have any sort of pain today on a scale of 0 to 10, with 0 being the worst pain you've ever felt and 10 being the most pain? Where would you be?
So 0 being the worst pain I ever felt?
0 being no pain at all, 10 being the worst pain you've
Oh
ever
yeah,
felt.
0 pain, no pain at all.
Okay, good. And can I get your height and your weight, please?
My height is 5'7", my weight is 192.
Okay, I gotta recount your pulse. Can I get you to smile for me? Frown, puff out your cheeks, raise your eyebrows. Okay. Okay, so my client's pulse was 72 beats per minute with a +2 amplitude, regular rhythm, taken radially. His breathing was unlabored, 16 breaths per minute with a regular depth. And now I'm gonna get your blood pressure. Temperature 98.7, taken temporally. Okay. Okay, so my client's blood pressure was 124/78, taken on the left arm. And with all of that being said, we can go ahead and get started with the assessment. I'm going to start from the top and work my way down. At this point, I would don gloves. Can I look at your head?
Yeah, go ahead.
Can I feel it?
Go ahead.
Okay. Is there any pain or tenderness whenever I do this?
Yeah, no pain, no tenderness.
Okay, that's good. Okay, so I want you to just look straight ahead for me. Okay, that's good. Try to follow this pin light. Okay, that's good. I want you to look at the pin and then look at the wall. Pin, wall, pin, wall. Okay. And tell me whenever you can see the pin.
I see it.
Okay.
See it.
Okay, that's good. Can I have you pull your eyes down like that? Okay, that's good. Can I have you scoot over? I want you to cover your left ear, and I'm going to whisper 3 words and tell me what they were. Chair, table, shoe.
Chair, table, shoe.
Okay. And then the same with the other side.
Hat, bag, charger.
Hat, bag, charger.
Okay, that's perfect. Okay, I'm just gonna look at your nose. Can I have you hold one nostril and breathe in, breathe out? And then the same with the other side. Okay, I'm looking at your lips. Can you open your mouth? Stick your tongue out. Okay, that's good. You can close it. Okay, can I have you look up and to the left? And then the other side. Okay, that's good. Do you mind if I touch your face?
Go ahead.
Okay. Is there any pain or tenderness whenever I do this?
No pain.
Okay. 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 Can I have you look up? Down, left, right, all around. Okay, try to do this. This is protraction and retraction. Okay, and try and raise your shoulders. Okay, that's good. We can move to the next part. Can I have you turn your back facing the camera, please? And let me ask you, have you had any type of a cough recently?
No cough.
Okay. So normally this assessment would be done with stethoscope to skin, but for the privacy of the video, we're gonna let him remain fully clothed. Whenever you feel it, breathe in, breathe out.
raise your right arm.
Left arm. Okay, can you turn around? Okay, do you mind if I feel your chest?
Go ahead.
Is there any pain or tenderness whenever I do this?
No pain, no tenderness.
Okay, I'm gonna listen to your heart next. Okay, so for this next part of the assessment, can I have you lay down on this table here? And let me ask you, have you experienced any difficulty or pain whenever you're trying to urinate or pass stools?
I haven't.
Okay. Okay, so I'm gonna go ahead and listen. When was your last bowel movement?
This morning.
Okay, and just to confirm, you said you have zero pain today?
You're okay.
No pain whenever I do this?
Yes, no pain. Still at 0.
Okay, can I have you sit down on the chair next? Okay, can you hold your arms out for me? Flip them. Okay. Okay, grab my fingers, squeeze. Okay, let go. Okay, flip. Okay, final thing, can I have you touch your thumb to each one of your fingers like so? Okay, that's good. Go ahead and put your feet on this stool for me. Okay. Look between your toes. Okay. Okay, there we go. That's gonna do that. And can I ask you, do you use any type of assistive devices?
I do not.
Okay. Can you try and raise your feet and then lower? Okay, final thing, can I have you try and drag your left heel along your right shin? And then vice versa. Okay, and next can I have you stand up and follow along with everything that I do? Okay. Okay, and then there's one final thing. Can I just have you take about 4 steps forward and stop safely, bend down if you can. Okay, so that's going to conclude our assessment today. You can have a seat, make sure you're in a safe and a comfortable position. I'm going to go document the findings with the provider and he'll be in to see you shortly.
He or she?
It's going to be a woman actually.
Okay.
Okay, so my client was alert and oriented ×4. Here's a call light for you.
Thank you.
My client was alert and oriented ×4 to person, place, time, and situation. He gets adequate nutrition. He demonstrates proper hygiene. There was nothing unexpected with his body positioning. His skin color was appropriate for ethnicity. His speech was fully intact. His hearing was intact. The client's mood was calm and collected. Upon inspection of the scalp, it was perfectly symmetrical. His hair was evenly distributed, and there were no masses or tenderness noted upon palpation. His pupils were equal, round, reactive to light, and accommodating. They were about 3 millimeters. His peripheral and his cardinal fields of vision were both fully intact. His sclera was white and his conjunctiva was pink. His ear canal was free of any redness or drainage. His external ear was also free of any redness or drainage or lesions. He went 3 for 3 on the hearing test bilaterally. His nose was midline with no drainage or lesions. His nares were fully patent bilaterally. His lips were pink and moist with no lesions. His oral cavity was also pink, moist, and no lesions present. He was able to stick out his tongue. His neck was symmetrical. There were no signs of any jugular vein distension. His carotid pulses were equal with a +2 amplitude and a regular rhythm. The client had full active range of motion in his head and his neck. He was able to shrug his shoulders against resistance, and upon palpation of his face, there were no tenderness or masses noted in the frontal and maxillary sinuses. His cervical lymph nodes were also non-tender and non-palpable. The client denied the presence of a cough. Upon inspection of his posterior and his anterior chest, it rose and fell symmetrically with no use of any accessory muscles when he was breathing. Upon palpation of his chest, there was no tenderness noted, no masses. Upon auscultation of his lungs, there were no adventitious sounds noted posteriorly, anteriorly, or laterally. S1 and S2 were noted in all 5 landmarks of the heart, with no presence of any bruise, murmurs, or gallops. His point of maximal impulse was present. It was +2 amplitude with a regular rhythm. The client denied any sort of a cough. And he also stated that he had no difficulty or pain whenever he was urinating or passing stools. His abdomen was non-distended, and his skin color was appropriate for ethnicity. It was round, flat, it was flat. Upon auscultation, he had normal active bowel sounds in all 4 quadrants, about 22 a minute. Upon percussion, there was tympany and scattered dullness noted in all 4 quadrants. Upon palpation, there was no rigidity, no masses, and no tenderness to note. His upper extremities were symmetrical in size. His skin was appropriate for ethnicity. His hair was evenly distributed. His nails were pink and fully intact. He had a capillary refill time of less than 3 seconds. Both of his radial pulses were equal bilaterally with a regular rhythm and a +2 amplitude. He was able to demonstrate coordination in the upper extremities. His grip strength was equal in both hands. His skin was warm and dry to the touch. On inspection of his lower extremities, they were symmetrical in size. His hair was evenly distributed. His skin was appropriate for ethnicity, and his toenails were fully pink and intact. There was nothing unexpected to report in between his toes. Upon palpation, his skin was warm and dry to the touch. There was no pretibial edema noted. All of his lower peripheral pulses were equal. The popliteal, the posterior tibial, and the dorsalis pedis all had a +2 amplitude and a regular rhythm. The client's capillary refill in his lower extremities was less than 3 seconds. He was able to demonstrate plantar flexion and dorsiflexion against resistance. He was also able to shrug his shoulders against resistance. The client denied the use of any type of assistive devices. He had full active range of motion in all extremities. His walking gait was balanced and well coordinated. There was nothing unexpected to note whenever he stood up or he sat down. Upon inspection of the client's spine, there was no abnormal curvature to note. It was fully midline. Overall, no unexpected findings with this client.